Hello, today we're going to be talking about everything that you need to know about Seroquel if you are taking it or if you're going to take it. I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist. I've worked for several pharmaceutical companies and I also worked at the FDA. And so I've kind of seen behind the veil of all of this stuff and I can give you the real truth about these medications. I actually share a lot of controversial opinions about psychiatric meds. A general layout for this presentation right now is we're going to go through the drug label so you can see the most common things that you need to know about the drug. And then at the end, I'm going to break it down and give you my overall opinion on Seroquel and who I think this drug might be used for and who I think should really avoid it. So everything's going to be based off dailymeds.com. This is an aggregating site for all of the most recent drug labels in the US. And so today, looking at Seroquel. So the first thing that you're going to notice is that there's a boxed warning on the top. This is the strongest warning for psychiatric medications. And what we're seeing here is two things. We're seeing increased mortality in elderly patients. When they've done studies looking at Seroquel in elderly patients for things like dementia, what they find is that there's an increased risk of death in the patients that get this medication. And so you might be thinking, oh my God, why would anyone ever take this if you are elderly, if there's an increased risk of death? There's actually a lot of use case scenarios for this. And usually what I'm thinking about is end stage kind of dementia, a lot of behavioral problems. You might actually take the risk of increased death if them being on this medication is keeping them in the home, it's keeping them with you, it's meaning that you're not shipping them off somewhere else. Or maybe they are in a nursing home already and it's just allowing the staff to care for them in a more compassionate way. So don't just read this and think, oh my God, increased risk of death, we're never going to do it. It's something you need to be aware of. And that's why I think for elderly people, they really need to have pretty severe behavioral agitation with the dementia if they're going to be getting Seroquel as a continuous medication. Suicidal thoughts and behaviors. This is for all psychiatric medications. People need to know that some people have paradoxical adverse reactions. And so the most common effect with a drug like Seroquel is one of general calming and blunting, and that can be therapeutic, but there's a small proportion of people that may become more agitated, more dysphoric, and you just need to watch them closely for the first couple of weeks after they start the drug to make sure that that's not happening. So two main risks. These are the risks that your doctor should have told you about before you started this drug. Indications and use. Okay, so schizophrenia, bipolar. Yes, this is an antipsychotic. It came onto the market with schizophrenia, but as you may know, a lot of the antipsychotics are also used in bipolar disorder. So they've run clinical studies in these populations to show that they've improved them, at least symptomatically in the short term. What you are going to notice that is not on here is the big one is sleep, right? Okay, so there's no sleep indication. And this is probably the most common way I see Seroquel used off-label. It's for insomnia. There's no clinical studies to support this. And we're going to talk more about this later on at the end of the presentation, especially if you're taking this for sleep, because that is a bad idea. So depression, schizophrenia. One thing that's not on, bipolar disorder and schizophrenia. One thing that's not on here is depression. But that's because we're on the instant release version of the drug that doesn't have the indication for it, but the extended release version did go through the FDA for depression. So you're going to see Seroquel used a lot as an adjunct for depression. So what this means is you're taking Prozac, Lexapro, any of these drugs, and it's not quite cutting it. And instead of switching you to another antidepressant, they're going to add this medication on top. That frequently happens with Seroquel, and there have been some studies that support that, at least in the short term, for symptomatic improvement. Dosage and administration, we don't really need to go into that. It typically starts at between 50 to 100 milligrams a day, and for things like schizophrenia and bipolar, it goes up to around 800, which would be where you'd max out on. Contraindications, this is fairly generic, hypersensitivity to that, there's no need to kind of focus on that. This is the real kind of meat of it. This is when your ears should perk up and really your doctor should have at least talked to you about every single thing on this list. Warnings and precautions in a drug label are the most important information that prescribers should tell all of their patients. So we talked about the increased risk of death in elderly patients with dementia-related psychosis, right? Suicidal thoughts and behavior, we've done that already. Okay, so here we go. Cerebrovascular adverse reactions. We're talking about strokes here. There's an increased risk of having strokes in elderly patients with dementia-related psychosis. Again, that sounds like a terrible thing, but there are use case scenarios for it where you may take that risk. Neuroleptic malignant syndrome. This is not something that the majority of people need to be aware of. It's a very rare but very serious adverse reaction of antipsychotics. Essentially, think of it as confusion. You have developed really, really high blood pressure, and you actually can develop a lot of tensing and rigidity in your muscles. So much so that you become so tense that the muscles start to break down, and it floods your body essentially with broken down muscle proteins that get into your kidneys, and they can cause acute renal failure. This thing here is like a big risk if you are getting long-acting injectable antipsychotics. Now, Seroquel doesn't come as a long-acting injectable, but we're usually thinking about large doses of Seroquel when you'd get this, or having it in combination with other antipsychotics, which frequently happens. Metabolic changes. Now, this one here is the most common problem with these medications, and really the reason why you shouldn't use them for something that's benign. When we say metabolic problems, we're talking about diabetes, elevated cholesterol, so increased risks of having cardiovascular disease and things like that. And the weight gain with not just Seroquel, but a lot of the antipsychotic medications can be massive. I mean, we're talking people gaining 10 to 20 pounds in the space of 6 to 12 months on these drugs. So this is the most common problem. This is probably like, we've talked about a lot of rare things, but if you're like a younger person and you're on this medication, this is the number one thing that you should be worried about. It's weight gain and metabolic problems, especially in the long term. Okay, tardive dyskinesia. Sorry, I take that back. This is another thing that young people should be worried about with this medication. Tardive dyskinesia is an involuntary movement disorder that usually starts around your mouth. You start getting twitching, your tongue kind of comes out. It can be potentially irreversible. This happens at an incidence of 5% a year, so that's like 1 in 20. So every year that you're on this medication, you have like a 1 in 20 chance of developing a permanent movement disorder. If your doctor did not tell you about this is massively negligent, because this is like the permanent, irreversible thing that can happen to some people. So this is really what you want to be keeping in mind when you're making this decision about taking this drug. It can cause low blood pressure as well. It usually happens pretty quickly. If you find that you're standing up and you're getting lightheaded, it may have to do with your Seroquel. It causes falls in the elderly. That makes sense. Anything that's somewhat sedative, like this medication, can make people have falls. Seems to cause some increased blood pressure in children and adolescents. Leukopenia, neutropenia, agranulocytosis. Now we're talking about changes in the makeup of the cells in your blood. Again, this is an uncommon side effect, but you would want to be getting your bloods CBC, complete blood count with differential, every 3 to 6 months on this drug, just to make sure that there's nothing unusual happening in your blood. But typically this is something where you'll end up in hospital because you're anemic, and then they may consider that this is the drug that's causing it. Got cataracts, QT prolongation. This is a problem with electrical conduction in your heart. People may have heart attacks from arrhythmias, rather than like a clogged artery. The rhythm of their heart may become asynchronous to the point where it stops beating. And this is a rare side effect, but it can happen with these drugs and a lot of other psychiatric medications. So, if someone has sudden death, which is, an immediately kind of like dropping to the ground without a heartbeat, we always think about QT prolongation from these drugs. They can cause seizures, they can lower the seizure threshold. That's fairly uncommon. And hypothyroidism as well. Hyperprolactinemia. This is high levels of prolactin in your blood. This can lead to things like gynecomastia in men. This is the appearance of breast tissue, actually. again, it's not super common with drugs like Seroquel. With drugs like Risperdal, this becomes a much larger problem where the hyperprolactinemia is a lot higher. Disturbance of cognitive and motor impairment. Yep, that's true with any kind of antipsychotic. And the discontinuation syndrome. This is pretty standard for all psychiatric medications. They are drugs. They cause tolerance. Some people have no problem coming off them, but there's a lot of people who have serious long-term problems stopping these medications. And one thing that's actually really interesting about coming off Seroquel is it makes people really itchy. There's an antihistamine-like effect with Seroquel when you take it, that when you withdraw from it, people they break out in hives. We're going to go down to the clinical studies. So, clinical studies section. Again, you want to notice 6 weeks. Okay, that was the duration of the registration study. You might be asking, why not any longer? A lot of this is based on precedent. When the first antipsychotics came on the market, they were short studies, so the rest of them have short studies as well. What does this mean kind of long term about these drugs? We don't really know. And there have been some maintenance studies that show that it prevents relapse in schizophrenia, but usually they haven't gone on that long, and a lot of people are on these medications for 5 to 10 years. We don't really have anything out that long with them. And again, much the same for bipolar disorder, but here we go. The acute treatment of manic episodes is what we have here. So this makes sense. Someone comes into a hospital, super agitated, disinhibited. You can give them Seroquel and it can sedate them to a point where that episode of mania resolves faster than if you just let them kind of burn out on their own. So we have an indication here for acute mania. Okay, so that's the overall overview. So what do I think about Seroquel? Number one thing, don't take Seroquel if you have insomnia. A lot of people just kind of get this medication kind of popped on there for the treatment of insomnia. There are way safer drugs to be on than Seroquel. You wouldn't take a drug that can cause tardive dyskinesia, a permanent movement disorder, even when there are other drugs out there that are just pretty dangerous as well, like the benzodiazepines and things like Ambien. Those ones aren't causing like tardive dyskinesia. There's other things that you could take like trazodone and things. So Seroquel for insomnia, do not do it. It's a really bad idea. I think it makes sense to try something like this for acute like bipolar episodes sometimes, especially if you're in a hospital and you're having a lot of like agitation. Totally makes sense to use it. You could also use this as an adjunct in the treatment of depression in select cases. But you'd want to be fully aware that there's a lot of problems with this drug, just as I'd mentioned, and you wouldn't want to take this for depression that was anything but massively severe and debilitating in your life. Did I miss anything? I'd like you to kind of drop some comments below. If you have any other questions about Seroquel, I'd be happy to answer them. Thanks.